Hello, everyone. It's Dr. Rebecca Branstetter back here with another episode of Coffee Break School Psychology. And I'm with Carrie Rodrigues, who is a school psychologist and licensed educational psychologist, and dare I say, a friend of mine. I shall. Carrie, are you caffeinated and ready?
I'm so caffeinated. I've had my 2 cups. Feel really good.
Excellent. All right. We're going to dive right in. I know that you do a lot of work with autism and you work at the California Early Childhood Special Education Network. But you come here today to Coffee Break School Psychology for a different reason. Can you share a little bit about yourself?
Yeah, I've been a school psychologist for 16 years, and autism was my passion. I worked primarily in preschool and elementary schools, and then probably in my 3rd year of being a school psychologist with preschoolers, I had my baby boy and, quickly realized within 10 months that he wasn't making eye contact, wasn't responding to his name, and became concerned about his development. And he started to show just all the hallmark signs of autism. I think around 20 months, I called the regional center and said in a shaky voice, I think my son has autism. And it all just went very, traditionally down the road of early intervention, autism diagnosis at age 3, special ed preschool, and then ABA therapy and special ed since that time. He's 13 now. He's awesome. He knows how to code in 8 different languages. He obsessively reads Wikipedia, super smart, and continues to have a lot of challenges socially. So that was my experience with him. Just he presented as very typical. I knew right away, like, that probably we were facing an autism diagnosis. And then I had a daughter who was born 21 months after he was born. And I was so relieved when she had social smiles and responded to her name, and showed pretend play. However, after the pandemic, when she started to go to school, back to school in 3rd grade, she struggled with the big playgrounds, and in 4th grade started to show rigidity and sensitivity to noise, and of course, and just attentional challenges. And I did not suspect autism. I actually told my partner at the time, I can tell you for sure this child does not have autism, because she had great joint attention and pointed and pretend play. Lo and behold, at age 10 in 5th grade, she did get diagnosed with autism. And so I've been very passionate about looking at the difference between females and males and how they present, because just watching them develop over time and seeing how the struggles manifest so differently in my house and watching 2 different children grow up, I'm extremely passionate about the differences in how male and females present with autism. And as a school psychologist, how much harder it was to recognize in a female.
That's fascinating. So it sounds to me like, and I appreciate you sharing your personal story because it's so interesting that here you are specializing in autism. You have a boy with autism, and then that diagnosis just completely wasn't even on your radar at all. In fact, you were positive that it wasn't. So it sounds to me like autism presents differently in girls. Can you share a little bit about some of the differences that you've seen, both as a mom, but just like in as a clinician?
Yeah, and I think as a school psychologist, there's probably in everyone's experience a girl that we missed, right? Like a girl, and I can think of a girl in kindergarten who was referred, who was rigid and kind of bossy, but made eye contact and, you know, maybe I said OHI for ADHD because, had a hard time sitting at circle and kept leaving the circle and was obviously having behavioral challenges. But I didn't suspect autism because there was pretend play and social engagement and friendships. And girls do manifest differently. What we're seeing is that boys tend to show more of the hallmark symptoms of autism that we know of, that we're taught to look for, things like the motor movements. Girls do not show those as often. So the flapping, the interest in parts of objects. So like my son really was interested in how wheels rolled before his eyes. That's very traditional, and many boys show that. Girls are more likely to show imaginative and pretend play. And that's something that we're looking for a lack of when we're assessing children. And girls often will show that. So, like this little girl I'm talking about in kindergarten had beautiful pretend play. And probably if I had a time machine and could travel back, I would now notice that it was really repetitive pretend play, like the same action over and over again. But and I can think that about my daughter too. Girls will have pretend play, but it might be pretty repetitive. Whereas boys might have a complete lack of pretend play and won't show any pretend play in early childhood. So where girls will also have the ability to kind of mimic social niceties in early childhood and kind of say, "Hi, how are you?" Maybe with that adult intonation, where boys may not do that. So they may be able to mask even in young childhood, and whereas boys won't show that, and they might say the hello and do the wave, and we'll rule them out of considering autism because they will show those things like pretend play, lack of motoric movements, and show those social niceties, and immediately we're like, check, it's not autism. um, and so we're looking at more traditional things for boys and that straight DSM criteria. Now, when I think back on my daughter's childhood, I will realize, oh, every soccer game ended up in tears and we had to leave early. Hated tags and clothing, hated, lining in socks. Every birthday party was a tear fest. So I can look at the developmental history and go back and see all the signs, but it just looked very, very different than my son and every boy I had assessed.
Yeah, I mean, if we think about when we're looking at diagnostic criteria, like present or absent, but like it can be present but qualitatively different.
Exactly.
So we've established that, autism can look differently in girls, and then we kind of seen some of the ways in which how it looks different. So what are some tools or tips or tricks for folks, maybe school psychologists, clinicians out there, or even like teachers and parents who are like, wait, something's like a curiosity, like, is this autism? Or like, what can folks do? How can they sort of catch some of these non-traditional symptoms and signs, or what would you kind of recommend?
Yeah. So the research is showing that girls tend to be diagnosed later than boys. And some of that is the masking that girls are able to do and the social mimicry. So girls tend to be diagnosed a year and a half or more later than boys. And part of that is the DSM has the notation that the symptoms might be there, but it's when the social capacity exceed, your ability exceeds, or the demands exceed your ability, right, to cope. And so I think often what happens is in fifth grade and beyond middle school, when girls no longer can just do pretend play on the playground, and that it becomes more about gossip and social nuance and relationships, and then they're like, what is going on? Why do we not no longer want to just play horses on the playground, and it's all about these relationships and conversations and gossip and social hierarchy. And then it really becomes very confusing for these girls who maybe do have autism. That's when it really starts to manifest. Maybe they feel excluded, or they feel like they can't hang in there with these conversations, or maybe there's cell phone texting going on and they're like, what, why, I don't understand this nuance. um, that's when girls start to show, loneliness and depression and more anxiety, and they might get those diagnoses first. There may be more signs of rigidity because they're trying to control this world. They may be melting down more when they get into the car with mom or dad at pickup. They may be showing more signs of need to control the social environment, so more rigidity, more difficulty with group projects, which start to ramp up in middle school and fifth grade. And so that's when we see more challenges. So teachers might start to see more rigidity in girls, less ability to do group work, more like need for everyone else to follow the rules, and more bossiness, that more upset when the rules aren't being followed, more sensitivity to sensory input might come out, and less ability to mask, right? So more frustration. And then girls might start to get those other diagnoses like ADHD or OCD because they need things to be just as they are, or ADHD because it's so hard to pay attention because they're so stressed by the social dynamics of school. And so when you start to see a girl get multiple diagnoses, And there's social challenges. That's when a parent or an educator or a diagnostician might consider, well, could this be autism when there's so many other diagnoses going on? And maybe we need to look at that. And then you want to go back into the developmental history with parents and say, well, were there sensory challenges? Did they ever have social challenges? What did their play look like?
It makes perfect sense because when kids are in kindergarten or first grade, they're like, I don't want to play with you. Like it's really explicit. Like they'll tell you, like, let's play this. I don't want to play that. And then, some of that social nuance really starts to emerge where I'd be like, nice sweater, Carrie.
Yeah,
It'd be
right.
like,
That is so hard to read when you have autism, right? You don't understand. My son says that all the time. He's like, I don't know if you're mad at me or you're happy. And I'm like, I literally was just like, you're awesome. You coded a calculator in Python over breakfast. Like, and he's like, I don't know if you're mad or happy. And I'm like, how could you not know? I'm literally like the happiest mom ever. Like, and that is truly lacking. Like, he's not sure. He doesn't know from my tone and facial expression if I'm happy. And that's truly an area that's hard for both boys and girls on the spectrum is reading facial cues and tone. And so that becomes really a challenge. And just like literal expressions and being able, if it's non-literal, that is so hard. Sarcasm, that's always been a challenge for both my children, is reading sarcasm. And that's what middle school is, right? Like sarcasm is just rampant. And so that's why middle school becomes so challenging, I think, especially for girls.
yeah.
And
And I can
just
see why the anxiety then ramps up too, because you aren't understanding. You're a stranger in a strange land of like, wait, everyone seems to be getting this and I'm not getting this. And then it can be like, what's wrong with me? And that introspection. And so, we've established that it looks different and that you might find like an alphabet soup of diagnoses that could be something that people out there could be like, wait a minute, like maybe there is an autism thing, even though they didn't meet like, say, traditional characteristics as a youth. So we love to kind of send people with, now we've built some awareness around this. We like to send people here in coffee break school psychologists a little extra shot of espresso, a little something they can take with them, a little nugget, a resource, or a piece of advice. Now that we kind of know to be on the lookout for autism, even if it doesn't show up in a traditional sense. Is there any sort of parting wisdom that you'd like to share with listeners?
I think what hits me as a school psychologist is there was a study done by Hiller et al, and it said that girls often present as borderline on rating scales, as teachers and parents rate them as with sometimes, that they circle those twos more likely. So the results come out when they do deserve a diagnosis of autism and they're later diagnosed with autism as at risk, like right on the border, right? And so there are school psychologists who would say, well, they don't qualify because they're at the at risk range. We're not going to qualify them. Whereas the study said that, and the study also showed that clinicians who were experienced diagnosticians would say, based off of the results, that these girls, they were ambivalent in their diagnosis. Like, well, they could be, but probably not at this time. And that really hit me, as that, we're denying these children the interventions they need and the services they need because it's at the border. And so I would say that you should consider, and the study said that you should consider borderline results clinically significant for girls, because we don't have the tools. Like most of the rating scales and test measures are really based off of males and male behavior. And we don't yet have the measures that are really based off of how females present. So when you're getting those borderline results and you have the developmental history and you have the sensory and the challenges, the social challenges, and you have a child who's not participating in group work and who's melting down at home because they're so stressed, when you have all of that, you really have to use your clinical judgment and make the call. And you have to educate yourself on what girls with autism look like. And you have to take the time to do that and not just take, the numbers. You have to, triangulate all that data to know what you're looking at. And so it's just really being nuanced and understanding that we don't have great measures yet. And it's up to you to really use your clinical judgment so that you're not missing girls.
Sounds like also there's like an element of being really persistent and just sort of documenting, all of these sort of symptoms and, looking at the qualitative and the quantitative together. Um, I'm gonna go a little rogue for a second here, and I actually, shamefully and unshamefully, am like addicted to TikTok and things in there, and I love watching neurodiverse people and their experiences, and so there is sort of a burgeoning community of people, of girls or women with autism who are now speaking out and being like, turns out all this time it was this.
Right.
And so I don't suggest any TikTok diagnostic criteria that you can't diagnose yourself through TikTok. But do you have a trusted book or resource that you can share with our group, or something that was really helpful for you to understand, like, what are these nuances?
Yeah, I really love, and I hope you can see. Okay, it's gonna be hard for me to show, but I'll tell you the title is
There you
"Women
go.
and Girls on Women and Girls on the Autism Spectrum" book by Sarah Hendrickx. This is a terrible showing,
No,
but
you're
you
wrong.
can get it on Amazon. And I love following on Instagram. I'm not on TikTok, but I'm not that cool, Becky. But I do follow women on the spectrum because, oh my gosh, they teach me about my children so much, and boys too on the spectrum. And I love neurodivergent Lou. She's a
I love
do you love her
her.
too? Oh my god, she's fantastic. And I feel like I learned about my children so much from her. Um, and I just thank her constantly because I'm like, that's why my daughter's doing this. And thank you for helping me be a better mom. She's amazing. And also just be a better like clinician and understand the kids that I'm working with better. So I learned so much from them, and and I think just educating yourself as a clinician, when we're the research isn't there yet, we have to like learn as much as we can so that we can support our kids better.
Yeah. No, I'm on team neurodivergent Lou. I love her. She posts both on Insta and TikTok. I'll drop her socials
Yeah.
below because it's really important to listen to the voices in the field, the people who actually have autism and can kind of speak to their experience, and we can learn the most from folks like neurodivergent Lou and others. Well, Carrie, this has been fantastic. I really appreciate you sharing your personal experience, and I think both that mom and school psych lens really is helpful for folks out there, because a lot of people think, well, school psychologists, they know all the things. And no, it turns out like we're all learning as well. And, I always thought like being a school psychologist would make me be a better mom. But actually, for me, it's the reverse. Like being a mom has made me be a better school psychologist, because it's hard. It's hard parenting. It's hard to, um, kind of in your own parenting journey, the struggles that we come up with. So it gives me a great deal of empathy for the families we work with when, you have kids yourself, because, and especially if you have kids who are neurodivergent, it's a different journey. So I appreciate you sharing that journey with us. I hope to have you back on the show to talk about more. And I hope the next time we talk, there are some amazing diagnostic tools, the Rodrigues scales of girls' autism symptoms. I don't know. I just manifested you making the scale, but here we are. I don't know if that's in your dream journal or not.
That would be amazing. I think there is actually a non-standardized scale by Tony Atwood for girls with autism that I've heard is somewhere on the web. But yes, that would be amazing. I think someone needs to get busy on this because girls are important and we need to have better tools. I mean, and I do think being a mom has made me, 1,000 times better as a psychologist, and just like way better at listening to parents because they are, they have so much to tell us about their kids, and also just listening to kids. I mean, my kids have taught me that, like, you gotta listen to the kids.
Yeah.
They know who they are and they know their story. So, thank you so much for having me on. It's been lovely talking with you today.
Thank you. And we'll see you next time on the next episode of Coffee Break School Psychology. I'll drop all of the resources we shared today in the show notes. And thanks so much, Carrie. We'll see you soon.
Bye.